All right, today we're diving into something that can be absolutely life-changing for people: bariatric surgery. We're going to break down what it is, who's a good fit for it, and maybe most importantly, what life is really like after the procedure. So let's jump right in.
Okay, so let's get right to the heart of it. At what point does a person's weight cross the line from a personal struggle to a serious medical issue that might actually require surgery? It's a huge question, right? And it turns out there's a very specific clinical answer that we're about to unpack. But before we can even talk about the solution, we've got to understand the problem. So first things first, let's be clear about what we mean by obesity from a purely medical standpoint. See, in a clinical setting, this has nothing to do with appearances. It all comes down to a number called the body mass index, or BMI for short. Once your BMI hits 30 or higher, that's medically defined as obesity. But then there's another level. When it reaches 40, well, that's when it's classified as morbid obesity. And that's a really critical line in the sand when it comes to medical intervention. And we're not just talking about a few isolated cases here. This is a massive global health concern. The reason doctors take it so seriously is because it can dramatically raise the risk of a whole host of other illnesses, and tragically, it can even shorten a person's life. It's often tied to something called metabolic syndrome, which is basically a perfect storm of conditions like high blood pressure and high blood sugar all happening at once. The thing to really get here is that this is an incredibly complicated puzzle. It's not about just one single thing. You've got genetics, you've got your environment, your personal metabolism. It's a whole mix. And because it's so complex, the standard advice of eat less, move more, it often doesn't cut it for people dealing with severe obesity. And that's exactly where a much more powerful intervention comes into the picture. For so many people, it's literally a life-saving one. Let's take a look at how surgery steps in as a solution. Yeah, when you're talking about morbid obesity, bariatric surgery really is in a class of its own. It's widely seen as the single most effective and crucially long-lasting treatment available. It truly creates a path forward to better health. But hold on, this isn't something that's available to just anyone. It's a huge deal, so there's a really specific checklist that doctors go through to figure out who is and who isn't a good candidate. So what are the rules? Well, they're actually very clear-cut. First, you're looking at someone with a BMI of 40 or more, or a BMI over 35 if they're also dealing with serious health problems linked to their weight. Think type 2 diabetes or heart disease. And then there's the big one. They have to have a documented history of trying and, unfortunately, failing with other methods like diet and exercise. This chart here really helps put those numbers into perspective. You can see the different categories, and if you look over to the right, those red zones, obese, class 2 and 3, that's a BMI of 35 and up. That's the territory where this type of surgery starts to become a serious medical conversation. And I really have to hammer this point home. Surgery is never step one. Never. It's a massive medical decision, and it only becomes an option after everything else has been tried and hasn't worked. It is, without a doubt, a last resort. Okay, so let's say someone meets the BMI criteria. That's just the beginning. From there, they go through this incredibly thorough evaluation by an entire team of specialists. We're talking nutritionists and, just as critical, a psychological evaluation. They need to be absolutely sure that the person is ready for the massive, lifelong mental and emotional commitment this surgery requires. All right, so let's say a candidate gets the green light. What actually happens in the operating room? How do these surgeries, work? Let's get into the nitty-gritty. Broadly speaking, there are two main game plans here, or sometimes a hybrid of the two. The first is restrictive. That's where they physically make the stomach smaller, so you just can't eat as much. The second is malabsorptive. That's where they actually reroute your digestive system so your body absorbs fewer calories from the food you do eat. So this image here gives you a good idea of what a malabsorptive procedure looks like. See how things are rerouted? It's definitely a more complex operation. And there's a trade-off. It usually leads to more dramatic weight loss, but it also means the patient has to be incredibly careful with their nutrition forever to make sure they don't become deficient in essential vitamins and minerals. This table breaks it down really nicely. You've got the restrictive options over here. They reduce stomach size, no intestinal bypass, and you get moderate weight loss. Then all the way on the other end, you've got the malabsorptive ones. Major bypass, very high weight loss. And of course, you've got procedures in the middle that kind of combine both strategies. It's easy to think the surgery is the finish line, but really, it's the starting line. The real journey begins after you leave the hospital. So what does that new life actually look like?
Get ready for this number because it's pretty incredible. On average, patients lose between 50 to 70% of their excess body weight. And let me be super clear about that. That's not 50% of their total weight. It's 50 to 70% of the weight above what's considered a healthy range. I mean, that is absolutely transformative. And the results go so much deeper than just a number on the scale. We're talking about weight loss that stays off long term. We're talking about potentially adding years to someone's life and a huge boost in their day-to-day quality of life. And for many people, things like type 2 diabetes, high blood pressure, even sleep apnea, they can just go away, completely resolve. So what about eating? Well, it's a very careful, phased approach. You start out with just liquids, then you slowly graduate to soft, pureed foods, and eventually you transition to your new normal, which, for the long haul, is a diet that's really focused on high-protein foods to get all the nutrition you need into that much smaller stomach. And honestly, if you take one thing away from this, let it be this. The surgery is an amazing, powerful tool, but it is not a magic wand. It's not a cure. The real, lasting success depends entirely on the patient's commitment to making huge, permanent changes to how they eat and live. The surgery gives them a massive advantage, but they're the ones who have to use that tool every single day for the rest of their lives. So that kind of leaves us with a fascinating question, doesn't it? Is this surgery the end of the journey, or is it really the beginning? For the right candidate, it seems it's not the end of a struggle, but the start of a brand new chapter. One that demands a lot for sure, but also offers the incredible prize of a longer, healthier, and fuller life.